from the College by the Lake, Coeur d'Alene, Idaho. Local, regional, national, and international guests discussing the issues and topics affecting the way you live are on Forum, the North Idaho College Public Forum, with your host and moderator, political scientist Tony Stewart.
Our topic today is the practice of chiropractic. We have three guests who practice in this field, and we're very pleased to welcome them to our program. This particular occupation is approximately a little over 100 years old, about 102 years old. It started in the United States. Today, the practice is worldwide. We'd like to welcome to the program, first of all, Dr. Larry Emery, who is practicing in the city of Coeur d'Alene, Idaho. And next to him is Dr. Mary Jo White, who also practices in Coeur d'Alene. And then next to her is Dr. Jeffrey Swartz, who is practicing in Post Falls, Idaho. We're very pleased that the three of you are with us today and all the work and preparation that you've put in with our staff to come to be on the program today. There are many things we want to talk about concerning your profession. And I want to welcome our regular panelist, Janelle Burke, who's an attorney in the state of Idaho, and she will commence a series of questions with all three of you at this time.
My first question today is for you, Dr. Mary Jo White. I've known you for some time, and it's going to be a pleasure today to talk to you about your profession. Can you tell me, what is chiropractic?
Thank you, Janelle, and thank you, Tony. I can easily get excited about this profession, but I think the easiest definition of chiropractic is for one to understand that it is a discipline of all the healing arts, and it is based on the simple principle that the human body is a self-regulating system, and it is a self-healing system. Both of those functions, self-regulating and self-healing, are controlled by the central nervous system, the brain, the spinal cord, and all of the nerves, down to a cellular level. And chiropractors address mainly, specifically, the muscles, the skeletal problems that could affect that nervous system. And science has proven that the nervous system is a very delicate process. And if it is irritated, if it malfunctions, if it is diseased, it can result in disease processes of the body. And our job as chiropractors, and our training, our education, is to help identify what those irritants may be, what the problems in the musculoskeletal system might be contributing to those, and then to correct them, remove them, and to also help the body maintain its healing process. And it's a multifaceted profession, meaning there are many things that we have to treat patients with.
And it's my understanding that you have a quote that you're very proud of.
We do. In my practice, I try to give a very simple definition, and Thomas Edison wrote once that the doctor of the future would give no medicine, and instead he would interest his patients in the care of human frame, in diet, and in the cause and prevention of disease. And that's basically what that's a basic philosophy to our profession.
Dr. Larry Emery, can you tell us what are some of the distinctions between your profession of chiropractic and, for example, a doctor of osteopathy? What's the difference between the two?
Well, chiropractic began in 1895, and a few years prior to that, osteopathy got its start in the United States, and chiropractic somewhat patterned itself after that, but osteopathy in the recent past has focused more on medical training, drug training, and surgical training, and for the most part today, medical osteopaths don't do a lot of manipulation. Some of the old-timers do, but they've kind of given up the art and science of manipulation, and chiropractic has taken the forefront in that area.
And what is the difference between chiropractic and the medical profession, for example? What kinds of things are different that a chiropractic doctor would do from what a medical doctor would do?
Well, basically, medical doctors and chiropractors are considered as primary care physicians. We see patients on a first-time basis, and we consult with the patient, and we do an examination of the patient to make a decision as to whether that patient would be one who would be best served by chiropractic or whether they would be best served by being referred to a medical physician. But basically, you might say that we are the largest drugless profession in the world, and we try to help the patient in every way possible by not using drugs and medications, and if those become necessary for certain disease processes, we will refer the patient out to someone who's qualified in that area of drugs and surgery.
And before the show, as we were visiting, you indicated that there are differences in the way chiropractic medicine is treated in various states. Can you indicate what some of those differences might be, so that for our viewers, this show goes out to a large audience, they might understand that there may be differences in the way chiropractors treat patients in one state from another?
Yes, well, each state has its own licensing laws and governing bodies, and some states have a little more liberal law than other states, and some states have a little less liberal law. In some states, for example, the state of Oklahoma, chiropractors can give injections in that state of natural bodily products. Again, in no state are chiropractors, in no state is a chiropractor allowed to do major surgery or to deliver children or prescribe prescription drugs. So we are limited to everything else, and I don't like to call it a limitation because there's a lot of other things that we can do besides drugs and surgery.
And what kinds of things are some of those new areas that you're getting into, for example, in your practice?
Well, basically, we are musculoskeletal physicians, but we are concerned about a patient's overall total health. And in my particular situation, I am leaning towards, as I'm in chiropractic longer, this will be my 30th, coming at my 30th year in chiropractic, and I'm leaning a little more towards the less physical part of chiropractic and doing more laboratory work and analysis and nutritional advice to patients on how to better take care of themselves and avoid, hopefully, medical treatment and medical expense, if at all possible.
Dr. Jeffrey Schwartz, my next question is for you. What does it take to become a chiropractor? What kind of education do you have to have?
It's a very rigorous program. For the first 4 years, the basic science, it's quite similar. In fact, an educational comparison between chiropractic and medical, we have many of the same classes on anatomy, physiology, geriatrics, pathology.
Perhaps we could put up some kind of a graph which might show some of the similarities. Would that help?
Yes. Mm-hmm.
So a graph that would show a comparison between the education.
Neurology, x-ray, physiology, or some of the other courses, orthopedics. At the kind of the postgraduate, what you'd call level, the chiropractor has more training in manipulation in orthopedics and the musculoskeletal system versus the medical doctor, and his training leans more towards pharmacology, pathology, and surgery.
Now, generally speaking, would a student have gone to college before they would go to school to do their graduate work?
Yes.
To a 2-year institution or to a 4-year institution? What generally is the process?
The present program is actually equivalent to 7 to 9 years of education. And usually it's a 4-year school now, but prior to going to a chiropractic college.
And can you tell us where you went to school?
University of Minnesota and Northwestern College of Chiropractic in Minneapolis.
I have the same question for you, Dr. White.
I did my undergraduate studies here at North Idaho College, and then I went to Minneapolis and went to school and graduated from the same school Dr. Schwartz did, which is Northwestern College of Chiropractic.
But Dr. Emery, it's my understanding you went to a different school.
Yes, I did my undergraduate work at the University of Utah and then graduated from the Los Angeles Chiropractic College in Southern California.
My question is for Dr. Mary Jo White. Again, we who are laypersons, we don't understand any of these different professions if that's not what we do, and a lot of us have very little knowledge of the human body from a physical perspective. Often we hear of your profession, we think of the spinal alignment, and that when patients come to you, that's often because there is been some kind of either accident or just from whatever the cause might be, a need to address that and realignment. I guess I have a two-part question. One is, you do work in that area, as I understand, and how do you deal with realignment? And the second part of the question is, what else do you do? That is, there's misconceptions that that once that happens, that you send the patient off and say, we have no more need to deal with that. Give us some edification on that in a more expansive way.
Well, the first question is relatively easy to answer. Chiro means hands, and chiropractic means the practice, using our hands. So typically you're going to see a chiropractic physician using their hands or the equivalent thereof to treat a patient. And after, the unique thing about being a chiropractic physician is it's almost like a puzzle. If someone presents to us with a complaint, we typically listen very carefully, take a history, try to process as much information as that patient can give us. Then we do an examination, and the examination is we take it for granted that probably anyone having that type of complaint would do this type of examination, but it's thorough. It's orthopedic, neurologic. We assess the body for posture. We look for gait. We look for a number of different things. We watch the skin, the color. Then, not to exclude blood pressure, all of the basic pieces. Then we possibly, more often than not, go on to the other diagnostic procedures, and that can include X-ray, MRI, laboratory work, as Dr. Emery mentioned. And then once we get the pieces all together, we try to answer the questions in the realm of what the body is doing as far as function. And even given a complaint of, say, for instance, headache, that may not necessarily be coming from the head. It could be coming from improper body function, which in turn would irritate the nervous system, which in turn ultimately would lead to some kind of a dysfunctioning or malfunctioning organ, tissue in the body. The true trick is then, once you have decided this, and it is an educational process to do that, is to decide how you're going to help the patient correct it. And oftentimes it is in alignment. And alignment can be anything from, if we look at this model that I have here in front of me of just 3 vertebral bodies, alignment can be if indeed any one of the vertebral bodies has been injured or malpositioned and placing stress on a nerve. My job as a chiropractor would be to identify that, possibly trace that nerve to the organs that it innervates, the tissues, including muscles, and then correct it. And we use that using manipulation or adjustment in our hands to do that.
We've also done programs, and I like doing programs with people in the medical profession too, and we did an excellent program with an orthopedic surgeon about certain kind of surgery when there is this whole question of the skeleton system and the nerves and how they are interwoven into that. So a nerve can get pinched in that process, and so you're looking for those kind of things too. Is that correct?
Correct. One of the things researchers have demonstrated is that an actual pinched nerve occurs only in 10 to 15% of the cases where you have severe pain. A nerve can be irritated, whether it's scraped, it could be compressed, and a pinched nerve is not necessarily rare, but it typically can occur if a bony process would indeed impinge on it. If I show you this particular model here, the vertebral column is designed so that the nerve root is allowed to exit.
So you are, if I can interrupt, you're holding on to a nerve there now, and we'll get a close-up. Okay, continue.
And if indeed there is malfunction or misalignment, it can even be if indeed the curvature, the normal curvature that is innate to the body, if indeed that is straightened through injury or trauma, poor posture, developmental issues, if there's stress on any of these nerves whatsoever, ultimately it could lead to dysfunction and possibly disease. And as chiropractors then, what we do is we try to relieve the stresses, the irritant, on those particular nerves. And the beauty of it and the excitement of it all is that with the body self-regulating, self-healing process, which is how I describe chiropractic to begin with, it oftentimes does not take much to boost that body back into the healing program, and it will heal itself. And even given bad nerve problems or that pinched nerve that you talked about, manually we can take care of those issues. We can help that body heal itself, and we typically do it without drugs and without surgery. And it's quite wonderful because the effects are long-term. Research has shown that it's very effective, very safe. I am amazed often, and I often say this, is how easy and how simple.
Dr. Emery, I'll come to you in relation to that too. And But there are situations that arise where an injury or a disease, whatever, has progressed to the point that there is no way to correct it without surgery. And so in those kind of cases, would you, like the other doctors are here, you would then at that point, if they are not already seeing a physician, you would refer them to a specialist in that field or a surgeon where the damage cannot be cured any other way. You would take that responsibility.
Correct. We do that very often, too often, unfortunately, in our society today because of lack of exercise and transportation and the easy life, as it were, being couch potatoes and bleacherites. People do not take care of their spines, and unfortunately they get to the point where stresses actually result in degenerative changes. And function follows form, and when the function is altered, then the form is altered. And once that happens and the disc begins to bulge or bone spurs grow around the joints because they're under constant inflammation, healing cannot take place in the presence of inflammation. And that's the only thing the body knows how to do is to present you with inflammation to try to heal. And if that proceeds over a period of time, then degenerative processes take place, and it becomes necessary to refer those patients for either a discectomy where they remove the disc, or a decompression where they remount the little opening, as Dr. White has pointed there, where the nerve exits. And these are surgical cases. We like to get them before that and help prevent those kinds of problems.
Okay. Dr. Swartz, my next question is for you. As you're trying to analyze, as Dr. White said, the complexity of the body and all the things that can be a problem, if during that process, or if you're doing x-rays or whatever, and I know you're working with other labs that have the ability to do those things, between that lab and your work, you discover another serious disease, cancer, whatever it may be, then at that point there is a work, of course, to the surgeon and so forth. Once the surgeon completes their work, do a number of those patients come back to you for dealing with diet or other things as they are recovering their health?
Absolutely. It's fairly common to actually work hand in hand. For instance, someone may have a problem in the low back where they have allowed it to go on too long. They have low back surgery, and they may need care for their neck or other parts of their spine while the low back is healing, for instance. So it's very common to work with them and at the same time while other problems are being treated.
One final question before I go back to Janelle Burke. I know some really wonderful organizations. One of them I'm thinking of is Hospice around the United States. And when they have patients, of course their patients are terminal. They're set up to serve terminal patients. But they have a team that works on each patient. It includes a physician, a nurse, and physical therapy, psychologists, religious leaders, and so forth. I just get you to react to that in relation to your profession. Should we, as we try to serve individuals, be more comprehensive and incorporate the different aspects and needs of a person that people in many different fields may need to be part of that team? Or Mary Jo, maybe you want to carry that one.
No, Dr. Swartz, go ahead and address that, and I'll add to it as you
Yes, that's really an exciting question that warrants cooperation between the professions. Chiropractic, because we work with hands, we actually touch patients. Most chiropractors are very sensitive to the patient needs and what happened with them. And because we have training in nutrition and exercise and everything, to be an integral part of the team would be very important.
Thank you. Mary Jo White?
I would just like to embellish that one a little bit in that it's interesting in that patients, and we have all treated patients in the scenario you just described, and it's always been interesting to me to watch how a simple chiropractic adjustment, if indeed it improves the functions of pieces that are affected, maybe not by the primary disease process, but the body itself is enhanced, the process is enhanced, the energy is enhanced to the patient. It's remarkable, and those patients that we have helped through these difficult disease process like cancer, and there's several others, it's simple, and they come back again, and it's not necessarily for nutrition. Oftentimes they present and do not know specifically what you can do for them, and it allows them to be healthier overall, therefore fighting their disease process.
Janelle Burke.
My next question has to do with the whole issue of soft tissue accident, presentations that you might see. What exactly is a soft tissue injury? For any one of the three of you, I think maybe Dr. Schwartz or Dr. Emery.
I could answer a little bit of that. Jeff could do a good job on that too, I think. I don't know if we can focus in on that model up there, but there's some little red structures in there. Jeff, maybe you can point to that, or just hand it to me if you would. The spine has two basic functions. One is to provide support for the body, for the arms and the legs and the torso, and the other function has to protect the nervous system. And as the nerves come out here, and typically we find a lot of whiplash type injuries, and they result in soft tissue injuries where there's swelling and inflammation and nerve pressure, and little nerves come out of the spine and attach themselves to this little blood vessel here that's called the vertebral artery. And those little nerves then wind around that vertebral artery and go up into the head. So many of our whiplash patients have headaches and lightheadedness and dizziness and ringing in the ears. And when we treat those patients, we try to correct the subluxations of the neck where the muscles have tightened the joints down and try to relieve that so the spine can go back into its normal mode of protecting the nervous system.
Dr. Schwartz, do you have something to add to that with regard to soft tissue injury?
Yes, a lot of times people think it takes a big baseball bat type injury or stepping off the curb and a very severe fall. But in, for instance, a whiplash or a car type accident, it's the change in acceleration, change in direction of the trauma that occurs as the body is forced back into the seat and the head follows, it's whipped, and in the other direction it's whipped. And the tearing of the tissues is actually 5 to 6 times as much as an astronaut gets going into space. It can be up to 12 Gs of force. Tremendous amounts of force can be applied to the soft tissue. Because it happens in microseconds, millionth of a second, the muscles aren't capable of establishing any protective mechanism at all. So the tissues are torn. And then if they're not taken care of properly in the healing process, they'll heal with scar tissue. And then 3 to 5 years later, the person comes into our office. I'm having neck stiffness, arm pain, headaches, and the whole scenario of symptomology that follows the care that was not given at the right time for that injury.
Now, earlier before the show, we were talking about the fact that probably most people think of chiropractors as bone doctors, and that you come because you've got a pain. Mm-hmm. But Dr. White, you were indicating that people don't always come because they've got a pain. Sometimes they've got a question for you. Can you tell our audience about that?
Thank you. Typically, they do come with a very specific complaint, and it is, as you described, pain. And often, and it's more often than one would think, they come with a question such as, I noticed that I have stiffness. I don't move up and down the stairs as well as I used to. Or I had an injury a few years ago, and I don't use my hands as well as I used to. It's an issue of function or poor function, typically, that will bring them in. Then there's a small segment, and many times these are family members of existing patients who have gone through the scenario of being in pain and having that corrected. They will bring their other family members in to have them checked. Oftentimes, people have said that the subluxation or vertebral body out of place is often a silent disease. It is there, it is occurring. Unless it irritates the nerves to where the body knows it's there, it just waits. It waits until it happens, and that's typically the person that bends over to get a pencil and they hurt, or somebody who sneezes and then they hurt. And what I'm seeing a huge influx in my office are children and young athletes. And so we get people who want to be athletically at their prime. They want to function better. We have children. We have children who go through the disease process, and typical treatment, including medicine, has not worked for them. They want to see if there's something else they could just, try. And we do get those patients who come in with no complaints and say, I want to know if I'm functioning correctly. So there is a huge spectrum of where we see these patients.
I might
Yes.
that many people would not think that it wouldn't be appropriate to go in and have their blood pressure checked because that's a silent disease, and many people wouldn't think of not going in and having a checkup for cancer because that's kind of a silent disease until it gets to the point where it's almost incorrectable. But yet very few people really understand the necessity of having their spine checked for the prevention of disease and disability, because most of our disability comes about because of musculoskeletal problems. A lot of our morbidity comes from heart disease and cancer, but a lot of our pain and suffering comes from spinal problems, and we can help those.
This is kind of a question for any of the three of you, but we've concentrated quite a bit on the skeletal, the backbone as a part, or the spine. But what about the other bones in the body? Are those also involved quite often?
I'd like to make this. I had a patient come in I haven't seen for 3 years, and his low back was bothering him. And as I was examining his foot, he winced, and I said, "You've got a little problem here, haven't you?" And he said, "Yes, I have." And he had what we consider to be a subluxation of the fourth metatarsal, plus a cuboid subluxation. I manipulated the foot. He came back a couple of days later for his back again. But before I treated him, he said, "You know, a year and a half ago I was running upstairs, I stumbled and I hurt my foot. My medical doctor couldn't seem to find a problem, sent me to a podiatrist. The podiatrist x-rayed, said he could feel something, but there was nothing he could do." And he said, "But I'm about 85% better today after that manipulation." So we do adjust not only the spine, but we do take care of shoulders and elbows and knees within the scope of our practice, of course.
Easy. They present oftentimes with that very specific complaint, meaning something in the extremities, into the hands, feet, knees, that type of thing. So again, we go back to function. If we can restore the function, we generally have a healthier patient.
We're running short on time, but there's a simple problem I want to get you to talk about, and then you can talk about your mechanism, how you do this. A lot of people wake up in the morning, they've slept the wrong way, the pillow's wrong, whatever, and they have a crick in the neck. That's really a common one. And I know they come in sometimes to your office, and I notice a little bit about what you do. You again, using the hands, you work. Do you work this? There's a soreness on. You work it into a particular place or location, and then remove it. Tell us how you do that.
Oh, the old crick in the neck problem. Yes.
A common one.
Well, first of all, you mentioned the sleep posture, improper sleep posture, and that oftentimes does result in...
We have less than 2 minutes,
right.
And even though that may be happening.
And what they're coming in with are the soft tissue thing that you brought up, meaning soft tissue, the muscles. So we work with the muscles. If indeed it is a problem of alignment, then we work to correct that, correct the muscles. Body can heal itself. They go on and they have long-term results.
And sometimes you can just work that out that very day.
Oftentimes, yes. Mm-hmm.
Well, thank all three of you for being with us. We've enjoyed this very much, being with you. And ladies and gentlemen, we're so pleased to have brought you this program. It's all the programs that we produce. And we'd like to invite you to be with us again next week at this same time when we shall discuss yet another issue. Until then, please have a good week. I am Tony Stewart.
The North Idaho College Public Forum was videotaped live from the studios of Instructional Technology on the campus of North Idaho College for viewing at this more appropriate time. We invite you to join us again next week for another all-new edition of the North Idaho College Public Forum on this public television station.